You gotta actively listen to what the person's saying and like understand what the person's going through and just trying to comfort them.
The privilege you have of walking that moment with a family or an individual, it stays with you, it lingers.
It's, I think, rare indeed to be able to find a place where you can really share your unvarnished truth about what it is to be going through this terrible loss.
Hospice Caring is a nonprofit, community-based organization that provides social and emotional support to patients who have a life-limiting illness and to their families and those who are grieving. We have 4 major core program areas, one being our Volunteer Helping Hands program, which is our patient caregiving and companionship program. We also have our adult bereavement support services, children's bereavement support services, and community education. We have about 12 paid staff and almost 300 volunteers, so almost everything is done by volunteers.
As a caregiver, interacting directly with my patients, I see like what kind of needs they need, and sometimes it's not just medication, but like more importantly, it's like the emotional needs. I just kind of expect it to be a 10-minute, quick introduction between me and my patient. That interaction became like an hour-long conversation because she was going through so much. Towards the end of the hour-long conversation, you can definitely tell that she was feeling slightly better, and then that, just the first interaction just kind of made me feel proud as well.
So we learned about Hospice Caring through our 19-year-old son, Brendan. He was diagnosed with cancer as a sophomore in college, and he lived for 14 months. I started to volunteer with the Good Grief Clubs, and the age population I work with there is the high school students. Usually it's just one session where somebody ventures forth, and then it's sort of like the doors open, and other people walk through that door and begin to share, and then they start to develop their own sense of a little community in that room. The way I've been able to volunteer with Hospice Caring has helped keep Brendan present for me.
I volunteer with Hospice Caring as an adult bereavement support group facilitator. My first husband passed away when I was 32 years old. I knew very early on that once I got my legs under me, once I was on steady ground, I just had to become a facilitator. In the training for Hospice Caring adult bereavement facilitation, we talk about the 3 needs of the griever: to find the words, to say the words out loud, and to know that the words have been heard. I think that what we do in these groups is we give a safe space for people to do just that.
Within our Camp Erin program, we have almost 50 volunteers who run the whole camp weekend. The way kids evolve and the way they blossom and open up in that 48-hour period is amazing. They get off the bus with so much more confidence and smiles on their face and feeling like it's really okay to start to create their new normal. Hospice Caring offers the most amazing community. Nothing like anything I've ever seen. It really is an organization that is run by the residents of Montgomery County.
It's not easy to take that step, to walk in there and walk in that door and to be greeted like you're a member of the family. It just makes you want to come back.
This one time when I was transporting my patient to the grocery store and we were driving back to her place, and then she just kind of all of a sudden just said, I think Penny did a great job matching you and me, and that kind of hit me pretty hard. And then it made me really proud of myself because, I mattered. My presence definitely did matter, and I was happy that I was able to help my patient.
It is the honor and privilege of my life to be able to sit and be a part of this organization and be a part of people's grief journey, to hold space the way people held space for me when I needed it most.